Let's talk about anticoagulants, especially the newer ones, the novel ones. But before we talk about those, we have to talk about the coagulation cascade, and it is so much fun. But I think I will give you some mnemonics that might help you memorize this once and for all. So let's take a look at it. We have the intrinsic pathway, the longer arm of the pathway. We have the extrinsic pathway, the shorter one. They come together at factor 10 and form the common pathway. So the intrinsic pathway, let's talk about this one first. It's actually, if you want to look at the integrity in the intrinsic pathway, you can look at how it's a clotting test. It looks at PTT. That's partial thromboplastin time. Its acronym is 3 letters, so it's longer. It's the longer pathway. Whereas if you're looking at the extrinsic pathway, the integrity of that pathway, you look at prothrombin time, which is just PT. So PTT goes with the longer one. So let's talk about that intrinsic pathway. When you hear intrinsic, you should think like inside the blood vessel. So let's say you have something that roughs up the endothelial lining of the blood vessel, maybe hypertension, some high blood pressure, the shear force hits the endothelium, maybe exposes a little bit of that collagen and von Willebrand's factor underneath the intima there. That's sticky to platelets. So if a platelet's coming by in the blood and it interacts with that von Willebrand's factor, it has a receptor for it, so it'll actually bind to it and hang on even with the shear force of the blood. That sets off those platelets that bind to von Willebrand factor, and they release serotonin, ADP, thromboxane A2. Serotonin is going to cause the smooth muscle to contract and cause some vasospasm. But ADP and thromboxane A2, these are platelet aggregators, so they're going to cause other platelets to stick to the platelets that are sticking to the von Willebrand's factor and start establishing that platelet plug. When that happens, you get this negative charge over the surface of the platelet plug, and that negative charge actually what activates this inactive protein that's circulating in our blood called factor 12. Once factor 12 gets activated, it activates factor 11, which skips 10, goes to 9, activates factor 9. Factor 9 forms a complex with factor 8, and together they go and activate factor 10, and that's the first factor in the common pathway. So that's the longer one. The shorter one is the extrinsic pathway. So think extrinsic, think outside the blood vessels. So there's this tissue factor that's outside the blood vessel. If something breaches that blood vessel where there's an interaction of the tissue with the blood, that tissue factor is then exposed to the blood, and there's an inactive form of factor 7 that's circulating in the blood. A lot of these factors are made by the liver and secreted by the liver in their inactive form. And when it interacts with factor 3, which is tissue factor, that activates factor 7. Factor 7 then activates factor 10. So you have just those 2 steps there. So that's the extrinsic pathway. And you can actually add factor 3 to factor 7. That gives you 10. So that might help you remember the extrinsic pathway. And then we have the common pathway. So once factor 10 is activated by the intrinsic and or extrinsic pathway, it then activates factor 5. Factor 5 activates factor 2. So factor 2, in its inactive form, it's prothrombin, and then when it gets activated by factor 5, it becomes thrombin. So thrombin is the active form of factor 2. Factor 2 then goes and finds factor 1, which is, in its inactive form, fibrinogen. It cleaves off some amino acids and takes that fibrinogen to fibrin, which is an insoluble form of the protein that then goes into that platelet plug and forms a meshwork that really strengthens that plug and forms a clot. So that's the common pathway. Now we can talk about where some of these drugs play into these pathways. Most of them are going to work in that common pathway because that's the most important one. That's where everything kind of converges to. So we have some NOACs. NOACs are novel oral anticoagulants. So the NOACs have asterisks over here. So 3 of them directly inhibit factor 10 from getting activated, and 1 of them directly inhibits factor 2 from being activated. So factor 2 is inhibited directly by dabigatran, and then factor 10 is kept from getting active from apixaban, which is Eliquis, edoxaban, and rivaroxaban. Rivaroxaban is also known as Xarelto. So those 3 drugs, and then this one, dabigatran on factor 2, all of these are direct acting These are the NOACs, and they can be used, say you have atrial fibrillation. With atrial fibrillation, you're not getting a good atrial syncytial contraction. You're getting kind of the contraction all over the atria, so there's some stasis of blood in the atria. Anytime you have blood sit somewhere, that can create a blood clot. And then those clots would move through the blood to the left ventricle and then, be ejected out of the heart, and they could go up through the carotid and into the brain and actually cause a stroke. So if someone has atrial fibrillation, it's important to get them on some anticoagulants. And these NOACs, these novel anticoagulants, have been kind of the drug of choice here of late, and they can help prevent that blood clotting in the atria from the fibrillation. Or let's say you have a deep vein thrombosis or a pulmonary embolism, they can be used in the treatment and prophylaxis of those as well. So those are the NOACs. And then we have some older drugs we've been using for a while. This includes heparin. So heparin actually can work on factor 10 and 2, but indirectly. So it works through activating this antithrombin 3, and then antithrombin, it enhances that antithrombin 3, and then antithrombin 3, it has an antithrombin effect. It prevents prothrombin from becoming a thrombin. It also affects that factor 10 as well. So that's heparin, and you can get into low molecular weight heparin and all that. We're not going to get into all that right now, unfractionated and all that. But another commonly used anticoagulant is warfarin, also known as Coumadin. And this one, it just kind of think of vitamin K. It involves vitamin K, and vitamin K is needed to form these 4 different factors: factor 9, 10, 2, and 7 by the liver. And if you don't have that factor or that vitamin K, then you can't make those factors, and that's going to have an anticoagulant effect. And so that's what warfarin kind of works through that. It's called vitamin K epoxide reductase is the key enzyme used there. But those are the different drugs. Again, these are used to thin the blood. Anytime you do that, there's also a risk of bleeding that has to be considered as a side effect. But those are the anticoagulant drugs, and I really hope that mnemonic helps with the pathways. Actually, you can look at this too. Once you get to 5 times 2 is 10, and then 10 times 1 also equals 10. So you get 10 through this pathway, and from here down you can get 10. That might help you remember the actual common pathway.